So, what is forward head posture? It is nothing but when you have a posture where your head is poking out forwards like this. Okay, simple enough, right? So, this is also called a nerd neck, a scholar's neck, or a turtleneck. You've seen a turtle, right? How they have their neck poking out like this. All right. So, before we go ahead, my name's Swati. For those of you who don't know me, I'm a physiotherapist, and I like to do these videos to bring awareness to patients and let them know what's happening with the different conditions that they have. And I strongly believe in patient education, and well, that's why I'm doing the videos. So, if you're watching me on Facebook, please do go over to my YouTube channel. And if you like what I'm telling you, please do subscribe. And you can press the bell button so you next time you get a notification to tell you when I go live on my channel. And if you're watching me on the live, say hello so I know you're here. Or if you're on Facebook, just give me a heart or like. So, and if you're on the replay, if you're watching me on the replay, please comment #replay so I know you've been here. Alrighty, so moving on to our topic for today. We are going to look at forward head posture today, and we're going to talk a little bit about what is it, and why is it actually important. Why should we even be looking at a forward head posture, right? So basically what happens with forward head posture is, if you've been say sitting at your desk for a long time, right, and you have just notice this: the next time you're sitting at your desk or watching a computer, just freeze and then see where is your neck. So if I turn sideways, are you here or are you back here, right? So that is actually a forward head posture when you're up here. I mean, in front over here. Okay, so why is it so important, right? And what are the symptoms that can happen because of forward head posture? What are the implications of having a forward head posture, right? So what happens with forward head posture is, an interesting study that tells us, is every inch that our head moves forwards, there's 12 pounds, or sorry, there's additional 10 pounds of weight coming onto our neck and our cervical spine. So basically, if I'm here, this is my neutral. If say we start on a baseline of uh, sorry, just 1 second. My Siri wants to talk to me in the middle of a live. Sorry. So if you are in neutral position, the weight of your head is sitting on your body, right? So it's transmitted through your cervical spine. So you have about 12 pounds. This is in pounds. Well, you can do the maths and convert to kgs. I'm not very good at numbers. So I have 12 pounds of weight sitting on my spine, right? On my neck here. And if I move ahead 1 inch, so if I'm here and I move ahead 1 inch, it'll be another 12 pounds of weight. So that's 32 pounds, sorry, 22 pounds of weight here. So another 2 inches, I'll be at 32 pounds, another 3 inches at 42 pounds, and so on. And you'd be surprised to see how much of a common scenario this is. This is a very common postural deviation, right? So this is, I mean, important enough for you to tell you that, this is, sorry, proof enough to tell you how important it is to keep your cervical spine in neutral, right? So what are the symptoms if you have a forward head posture? So you basically get pain or soreness around your neck or cervical spine area. You will have, you can have, because you're out here, so you see everything's out of alignment, so you can also have pain around your jaw. You can have headaches going up into your head, because forward head posture actually happens in the upper cervical spine, and the nerves that are coming out from the upper cervical spine, these are the ones that go and supply into your head. So if you get frequent headaches, look at your posture. Do you have a forward head posture? We'll cover how to check for forward head posture later on in the next live video. So you can also have issues with shoulder pain, because see, if I am forward here, I will have to go forwards with my thoracic spine, or basically get into like a rounded position at my thoracic spine in order to compensate for this forward position. So you see what's happening here is my shoulders, they will be in a compressed position. So this is not the neutral, this is neutral for my shoulder joint. So I might have impingement type of pain into my shoulder. And also because you are out here, you see the chest cannot expand so well. So you might have issues with your breathing, right? So you might feel that you're not getting enough oxygen, or you have a more shallow breathing, or somebody else might point it out to you saying your breathing doesn't seem normal. So all that will happen with a rounded shoulders. That is an effect of the forward head posture. Now, obviously, you'll have more tightness around your pecs and your front muscles here. There'll be a lot of stretch weakness on the back of the neck and these upper back muscles as well. So it's not just your upper cervical spine, it's actually involves the whole area, right? The upper part of the body. So because our body doesn't work in isolation, so every part gradually starts to get affected one after the other. It's like a domino effect. So the longer you have the problem, the longer you take to fix it, the more problematic things become. Now, what happens in the long term now? Uh, you will have increased compression on your cervical spine. So how does that matter? What happens is, because of that, you will have more stresses on your ligaments, your bones, your joints, your muscles in that area. Your spine will degenerate, your cervical spine will undergo degeneration faster than it would have if you had been in a normal posture, right? And then obviously your shoulder mobility can get affected. Then you can have issues around there as well, right? The way your scapula moves, your shoulder girdle, as in the upper back moves, the scapula moves, all that alignment will also go off if you look at things in the long term. So yeah, so that was, I'm just looking at my notes here. So yeah, that was it for the effects of the forward head posture. I mean, important enough for us to look at it, right? So what are the causes now? Why does it happen? Firstly, and very commonly, if you're one of those people who use a very high pillow, right? Especially if you're lying on your back and you have a pillow that doesn't keep you in neutral, but it actually puts your head right here, right? If I have a very big pillow, I'll have to bridge this gap, right? This pillow bridges the gap. So obviously I'll be very in front, right? So this is obviously going to cause forward head posture, not just once, but constant use of a very high pillow. Or if you're one of those who like to lie down on the couch, but then you use the handrest of the couch as a pillow. So basically your head is sitting on the handrest of the couch and your body's on the couch. So obviously you tend to be more forwards, right? It's not a pillow, it's meant for hand support. That's why it's called a handrest, right? So that will be a forward head posture because of these. Or if you have been staring at a screen for a very long time, that can lead to a forward head posture. If you use a very heavy backpack, okay, so in order to balance a heavy backpack, what will you do? This, right? The moment you do this, the neck will have to balance itself. So now you see it's coming from your thoracic, going into your neck. So it can be the other way around also, like we had said earlier, from your head coming into your thoracic, right? So gamers, people who use the computer or iPads, or kids nowadays, you see them on the tablet all the time. This is what they do. So you see what's happening to my neck? Forward. So that's another thing. People who drive for very long distances. So when you're driving and then you start slouching, and then this happens again. So basically forward head posture can come in. So these are the scenarios in which usually forward head posture is seen. Obviously it's not an exhaustive list and can be more. So yeah, that was it for forward head posture. So, oh yeah, another thing, when people look at their phones or they're reading a book, so suppose I've got a book here. So what they do is, if you look at me sideways, this, right? You go on the public transport, or if you're sitting in an office or reception area and waiting somewhere, maximum number of people will be on their phone and they'll be like this. So forward head posture is not just poking your head out like this. There are two types of forward head posture. It's getting technical, but then this is what I want to say is this is also a form of forward head posture. Okay, so we'll cover the solutions in the next video, but then I just wanted to highlight that these are the two types of forward head posture, and we'll look at how to correct them both in the next one, which I'll be doing in 2 days' time. So, yeah, if you have any questions or you want me to cover any specific aspects of forward head posture, please do let me know and I'll be happy to help you. If you like what you're watching, please go on and look at my Facebook group. It's called Pain Free Dynamic Life. And we discuss these topics in a very judgment free, friendly manner over there. So please feel free to join the Facebook group. The link is in the description below. Alrighty, it was good talking to you guys. So I will see you next time in 2 days' time. Bye.